Welcome to the Trauma Assessment Station. You have 10 minutes to perform your assessment and voice treat all conditions and injuries discovered. You have one partner who is trained to your level of care and will correctly perform the verbal treatments you indicate necessary. You now have several minutes to look over your equipment, and I will give you your scenario when you are ready.
I'm inspecting my equipment. I have a BLS bag, a backboard, splinting material, airway equipment, and all the material needed to perform this skill.
Okay. And you are dispatched with your partner to the scene of a shooting. You may begin when you are ready.
I am ready. My BSI is on. I'm checking to make sure my scene is safe considering this scenario.
Okay. And noting the BSI and your scene is safe.
Okay, my mechanism of injuries is shooting. I appear to have one patient. I'm going to call for ALS, and I'm going to request my partner holds C-spine in a neutral in line position and doesn't let go.
Okay, noted.
My general impression of this patient is a male lying supine outside. Going to assess for responsiveness using the AVPU scale. I need to know if my patient's alert and if they look at me when I walk in.
And your patient is not alert and does not look at you as you approach.
Okay, verbal stimuli. Sir, can you hear me?
And there is no verbal response.
Grabbing the trapezius muscle, I'm checking for painful stimuli.
And the patient moans and withdraws from painful stimuli.
Okay, so that I will note that. This patient moans to painful stimuli. At this point, my chief complaint is unknown. I need to expose my patient and look for any apparent life threats.
Okay. And as you remove the shirt, you note that there is a small amount of blood that has stained, and there is also a 2-centimeter puncture just below the right nipple.
Okay, so I note that my patient may be suffering from a sucking chest wound. Okay, so at this point, immediately I need to treat it. Going to take an occlusive dressing. Okay, I'm going to tape it on all 3 sides. I'm going to apply it.
Okay,
Over
noted.
the wound. Okay, if this is adequate, going to move on to my patient's airway. I'm going to open the airway using the jaw thrust maneuver.
Okay.
Inspecting the airway for blood, teeth, vomit, secretions.
And the airway is clear.
Okay, so there's no foreign bodies?
No.
Excellent. Okay, at this point I'm going to assess the patient's respiratory rate.
And the patient has a respiratory rate of 16.
Okay, within normal limits, we're going to give that, treat that with a non-rebreather mask connected to 15 liters, 100% oxygen.
Okay, and consider that done.
Okay, circulation, going to assess the patient's carotid pulse because they're unconscious.
And the patient has a weak carotid pulse at a rate of 120.
Okay, noted. I'm going to assess my patient for any major bleeds.
There's no major bleeding that you note.
Checking the patient's skin color, temp, and condition.
And the patient is pale, cool, and diaphoretic.
Okay, that being the case, the patient is most likely in shock. I'm going to treat the patient with a blanket. Okay, this patient is a high priority transport. Okay, we're going to transport right away. At this point, I'm going to start my assessment.
Okay,
Okay, I'm going to send my partner for a sample history.
noted.
Right now, I'm going to check the top of the head, back of the head, sides of the head or the skull for any decap, BTLS, crepitation.
And your exam is unremarkable.
Okay, checking for any blood on my gloves.
There's no blood on your gloves.
Okay, I'm going to check the face, around the eyes, zygomas, maxillae, mandible, for any decap, BTLS, crepitation.
And there's nothing that you know.
Checking the pupils, see if they're pearl.
Pupils are pearl but sluggishly reactive.
Okay, I'm going to note that. I'm checking from the nose, mouth, ears for any blood, CSF.
There is no blood or CSF from the nose or ears.
I'm going to confirm that my O2 therapy is still adequate.
And your O2 therapy is adequate.
Moving down, I'm going to check the patient's neck for any decap, BTLS, crepitation. Checking the back of the neck for any step-offs. Is there any blood on my gloves?
There's no blood on your gloves. There are no step-offs or crepitus noted to the cervical spine. However, there is tracheal deviation to the left, and there's also JVD present.
Okay, so I check for JVD, tracheal deviation, and find that it's present. I'm going to note that. At this point, I'm going to measure and apply the appropriate cervical collar.
Okay.
Coming down, I'm checking the patient's shoulders and clavicles for any decap, BTLS, crepitation. Anything noted?
Unremarkable.
Keeping in mind the patient's chest wound, still going to check the chest for any decap, BTLS, crepitation.
And other than the puncture wound, which you have already treated, there are no findings.
Looking for any paradoxical motion, any flail segments.
Unremarkable.
Checking the sternum using a chopping motion.
Sternum is intact.
Using my stethoscope, I'm going to auscultate for lung sounds at 6 positions. Check 6 positions. What do I hear?
And lung sounds are absent on the right side.
Noted. At this point, I'm going to check for decap BTLS, distension and rigidity of the abdomen, starting with the upper left quadrant, decap BTLS, distension and rigidity, upper right quadrant, decap BTLS, distension and rigidity, lower right quadrant, decap BTLS, distension and rigidity, lower left quadrant, decap BTLS, distension and rigidity, and the bladder, decap BTLS, distension and rigidity.
And abdomen is soft, non-tender, non-distended, atraumatic.
Checking the pelvis using an in and down motion for decap BTLS crepitation.
Pelvis is stable.
Checking the patient's left leg all the way down for decap BTLS crepitation.
And you note that there is an open fracture of the left tibia.
Okay, note the open fracture of the left tibia. Checking the patient's left foot for PMS.
And pulse is present.
Motor, can the patient wiggle his toes?
There's no response from the
Can the
patient.
patient feel me squeezing?
And no response from the patient.
Patient's left arm for any decap BTLS crepitation. Pulse.
Pulse is present.
Patient wiggle his fingers.
No response.
Can the patient feel me squeezing?
There is no response.
Step around my patient. Checking the patient's right leg for any decap BTLS crepitation. Checking for a pulse.
Pulse is present.
Can the patient feel me squeezing?
There is no response.
Can the patient wiggle his toes?
There is no response.
Checking the patient's left arm for any decap BTLS crepitation. Checking for a pulse.
Pulse is present.
Can the patient wiggle his fingers?
No response.
Can the patient feel me squeezing?
No response.
At this point, I make note to the fact that I forgot to perform a genital sweep. So I'm going to perform a genital sweep looking for priapism in males. If it were a female, I'd look for hemorrhaging.
And no priapism.
Okay. Noted. At this point, I need to check the patient's backside. I note that he has a possible sucking chest wound and pneumothorax. In order to not compromise the patient's good lung, the left lung, I'm going to roll this patient onto his injured lung.
Noted.
Using a partner, we're going to log roll the patient on C-spine's count. We would interlock arms. Again, on C-spine's count, we're going to log roll the patient towards myself.
Okay, on 3. 1, 2, 3.
Checking the patient's back of the head for any decap BTLS crepitation. Any blood on my gloves? Checking the back of the neck for any decap BTLS crepitation, any step-offs. Checking the thoracic, lumbar spine for any decap BTLS crepitation, any step-offs. Expose the patient. I'm going to check the rectum for any bleeding. Checking the back of the legs for any decap BTLS crepitation. Checking the left leg for any decap BTLS crepitation.
And your exam is unremarkable.
Okay, at this point we're going to insert the longboard. We're going to roll the patient back onto the longboard on C-spine's count.
1, 2, 3.
We will secure the patient to the longboard, making sure the head is last. We'll recheck PMS. At this point I'm going to manage any secondary injuries, which would involve splinting the patient's leg. I also need to obtain baseline vitals. I have not done that yet.
Okay.
Okay, so again, I start with the patient's skin color, temp, condition.
Still pale, cool, diaphoretic.
Check the pupils.
Pupils are pearl but sluggishly reactive.
Reconfirm the airway and respiratory rate.
Airway is patent, and respiratory rate is still 16.
Okay, come down and apply a blood pressure cuff. Okay, obtain the patient's blood pressure.
Your patient's blood pressure is 90/50,
Recheck the pulse, which would be the carotid because they're unconscious.
and patient still has a weak carotid pulse at a rate of 120.
Okay, noted. Again, I've managed any secondary injuries. I would reassess this patient every 5 minutes because they are unstable. I'm done with this station.